Hi, good morning, Dr. Kent. So, thank you for coming out and talking to us today. I would like to know how long you've been in this field of stem cell, and maybe you can give us a little bit of insight as to how you got into this field.
Well, actually, I've been in the stem cell regenerative medicine for the past 5 years. And it's quite interesting how I got into this. It was actually my parents in law who was interested in using stem cells for anti aging purposes. And that is when I started researching and understanding about how stem cells can be used for anti aging as well as regenerative purposes. So that's how I got involved in stem cells. I'm an allergist and immunologist by profession. And as an immunologist, I can't understand how stem cells work. I went to do my research on all the available stem cells and how it can help in terms of regenerative purposes. And that's how I got into regenerative medicine using stem cells.
It's great. Okay. So, Dr. Ken, these days there's a lot of people that are quite young and they are looking at stem cell to have a rejuvenative and even look better. And also, there are older people that want to live longer and healthier lives. Maybe you can let us know, are they suitable for stem cells? Or do you think that perhaps you should wait a little longer before you get a stem cell infusion?
I think we now realize that actually the human body ages rapidly after 25 years old. So when we look at the blood of a 25 years old and younger versus a person who is 40 years old, the amount of stem cells in your body has declined. So we used to think of using stem cells when you're older to treat diseases. But I think we're changing our mindset on this. I think we have to think like how we maintain a car. So you have a car, every 5,000 kilometers, you're going to take it for servicing, you're going to change the oil, you're going to make sure the brake pads are working and making sure the engine works properly. I think we're thinking about using stem cells like that as a health maintenance rather than to treat diseases. So people are thinking of using stem cells when they are much younger, when they don't have any diseases, and using stem cells to prevent diseases, to maintain health, to stay healthy. When you are 80 years old, you feel like you are 30 years old and you're able to perform at 30 years old. At this point in time, the mindset has not changed for most people who are thinking about using stem cell treatment. Right now, we usually have people who are around 70 and 80 years old and they're aching everywhere and they want to use stem cells to try and help themselves. Well, it's better late than never. That's how I look at it. But I think now the mindset has changed. We're going to use stem cells in younger and healthier people so that they maintain their health rather to treat diseases. So like they say, prevention is better than cure. So you use stem cells early to prevent having diseases later in life.
That's interesting. How about for people with ailing bodies? So, for example, what kind of illnesses or ailments that you would say require more stem cell treatments? Things like, is diabetes good for stem cells or arthritis?
Yes. So if you're healthy, the stem cells work much better in terms of maintaining your health and giving you regenerative purposes. But if you have diseases like diabetes or you have liver diseases or you have arthritis, then the stem cells objective when you infuse it in the body is to actually repair those first. So if you have diabetes, everybody thinks it's the sugar, but it's not. Think about the sugar as a poison, and it's poison all over your body, destroying your cells, destroying your organs, destroying the blood vessels. So this stem cell's job at that point in time is to actually reverse all this poison that's accumulated in your body, reversing the clogged pipes in terms of your blood vessels, decreasing all the damage that's in all your organs. So when you have diabetes, the stem cells try to do that. Same thing if you have arthritis or you have joint problems, the stem cells' job is to help these joints repair itself, reduce the inflammation tendons, help you function better, get your muscles stronger so that you have less injury into the joints. So As opposed to a young, healthy person, when you have disease processes, the stem cells' job at that point in time is to reduce inflammation and to improve healing.
So, Dr. Ken, I've heard about animal stem cells treatments such as sheep placenta. What are these stem cell treatments and are they safe and effective?
Now, that's a very good question. When we talk about animal stem cell treatment for humans, this actually occurred quite a while back, about 20 years ago, when that was the only technology that was available. Human umbilical cord derived stem cells, human mesenchymal stem cells, is actually a recent phenomenon because this discovery of these mesenchymal stem cells only occurred in the past few years. So 20 years ago, the only cells that people knew how to work with was animal stem cells. They derived that from sheep or goat, and they usually obtain it from the baby goat or the baby embryo of the goat or sheep, where they get sacrificed and they receive these stem cells. And these stem cells do actually produce some cytokines that have shown some health benefits. But that's 20 years ago. We now know that people who are receiving these stem cells, over a period of time, they start having reactions to these stem cells. Just like we know that using organs from goat or sheep is not compatible for humans. So these cells are not compatible with humans in the long term. And if you continue to use it, you're going to get side effects. So I highly do not recommend that. Because we now have better technology and better cells, we now know these new cells, the human-derived umbilical cord mesenchymal stem cells, are much more superior. They have much better capabilities in terms of regeneration and healing. So why use a product that is not compatible, that's from an old technology, when you have much better treatment options currently?
So, is there any difference between oral and infusion based stem cell treatments?
Absolutely. When we talk about stem cells for regeneration purposes, as well as for anti-aging, as well as for healing purposes, these stem cells are actually alive. They're taken from a frozen state, taken out, thawed, and they undergo cell replication, and the cells are alive, and while they're still alive, they are infused into your body so that these cells can do its job. Cells that are advertised, that you hear nowadays in radio or you read in the internet or magazines, they are in liquid forms or tablet forms where you consume. The cells are not alive. We don't even know if there are really stem cells in there. And when you take them in the oral route, you get digested. It's no different from eating a piece of apple, for example, or drinking a glass of milk. You only get the nutritional benefits of it, but you're not getting any stem cell benefits. It doesn't work. The stem cells have to be alive and they have to be infused intravenously, and it has to be compatible with human in order for it to work. So all these modalities of stem cells, it is gimmicky or marketing. You hear it in tablets, in liquids, even stem cells in creams, but they don't really work because that's not how stem cells are published, that medical science backing work. It has to be alive and infused intravenously into the host.
You talked about umbilical stem cells. Is this the only form of stem cell? And are there different types? And why is this better for us?
When we look at the stem cell treatment, there are two options really: allogenic or autologous. We'll start with autologous to explain it a little bit better. Autologous, that means it's your own stem cell. You take it from your own body, you replicate it into a much more higher amount, and you infuse it back to your body. That's autologous. The second one is allogenic. Allogenic stem cell, that means same species that is infused into the human body. Now, we look into mesenchymal stem cells, autologous versus allogenic. Is the allogenic, that means same species, different human, mesenchymal stem cells, is it compatible? Well, it turns out yes. These mesenchymal stem cells that are derived from umbilical cord and is allogenic, they do not express certain receptors. So we have it called immune privilege. That means your body's immune system tend to ignore it. Plus, these stem cells, if you think about it, they're going around repairing the body. So if someone comes and offers to clean your house for you free of charge, they're gonna repair any damages in your house. You're gonna leave them alone. You say, please come again soon. The same thing with these mesenchymal stem cells. When they infuse in your body, your immune system goes like, wait, you're doing good things. Why are we going to attack you? We're going to leave you alone. So these mesenchymal stem cells, umbilical cord, are immune privileged. They have been shown not to stimulate the immune system, and they provide benefits. That is different from your autologous. Your autologous is from your own body. Now this is where it differs. If you're young, if you're 25 years old, 30 years old, you can definitely use your own autologous mesenchymal stem cells because they're young and you're young and healthy. It hasn't been exposed to all the stresses of life. But if you're 50 or 60 years old, you have already an inflammatory milieu in your body, you're exposed to multiple toxins, you haven't been living a very healthy life, then your mesenchymal stem cells that's obtained from your body, we think the quality is not as good as a pure, naive, umbilical cord derived mesenchymal stem cells. So the recommendation is the younger you are, the better you are in using your autologous mesenchymal stem cells. But if you're not in that category, then using an umbilical cord derived mesenchymal stem cell is a much better option.
So this procedure is very safe. How do they keep control over the safety of procedure?
First of all, when you undergo treatment with stem cell, you want to ensure safety. Safety is the most important thing. So you want to go to a healthcare facility, a healthcare provider which is accredited and have specialty training in performing stem cell treatment. So you don't want to just walk into any shop and just say, I want a stem cell treatment, and right away you get a shot. That doesn't work. And I caution people from approaching that. And if that's offered to you, be extra careful. So in order to ensure safety, first go to an accredited location. And also make sure that the stem cells that you receive are accredited. These stem cells that we're giving to you are accredited in an accredited facility as well as an accredited manufacturing practice facility. So you're going to get a certificate that shows that, look, these stem cells are what they say we are. They have the amount listed. It's free from contaminants as well as bacteria and viruses that can cause problems. And also, during the stem cell infusion, the healthcare provider will be there in case you run into any reactions or any adverse events. The healthcare provider must be familiar and able to treat if there's any complications that arise.
So I'm going to ask something very personal. As you know, I'm a lady and all ladies like to be pretty. How does stem cell help with the way I look? Does it improve the way I look?
Stem cells' ability for regeneration is quite different from most aesthetic procedures that everyone is familiar with. For example, if you get a Botox treatment which relaxes the muscles for wrinkles, you see that immediately within 2 weeks, you have the relaxed muscles, you don't get the wrinkles, you don't get the frown lines. Or you get a filler where you get injection and you get the volume, you get immediate results. Stem cells don't work that way. Stem cells is a gradual process. If you're looking for immediate effects, you're not going to see that with stem cells. What stem cells does is create the beauty from within. So what you'll have is you'll be healthier, you'll feel more energetic, your skin repairs better, you have less wrinkles over a period of time, your skin turgor, elasticity improves. And the stem cells work over a period of time from months to years. And as you continue to receive stem cell treatment, the regenerative purposes continue. If you receive just aesthetic treatment, you have to continue to have a top-up, a repeat procedure. Stem cells are different. Each procedure of the stem cells build upon the other, and you just keep on getting improvement. Well, we do have clients and patients that do both because they want to look pretty fast and they want to maintain their aesthetic benefits. So that's when you combine the treatment with fillers, with Botox, with PRP, and stem cell treatment together. So it's very important to talk to your healthcare provider on your expectations so that we can craft a treatment program. So you don't just get a stem cells and that's it. So let's say if your objective is to have aesthetic improvements, we can combine them with all these treatment modalities. Think of stem cell as a tool, and this tool is very powerful, but it works differently from many other different tools. So you choose the proper tool for the right job, but also you have to plan ahead, and you use the tools in each specific segment to achieve the lasting effects that the patient requires.
My next question is about the frequency of the stem cell treatments. Can you tell me a little bit of how often we should have these stem cell treatments after our first?
So I'm going to discuss about stem cell treatment. Stem cell treatment depends on few variables. Number one, the host. The condition of the host will determine the outcome of the stem cell treatment. We also determine by the amount of stem cells that's being infused. So if you use very little stem cells, you're not going to get the effect. And also the frequency of infusion of the stem cells. So these are the three major factors. So let's talk about the host. If you are young, if you're 30 years old, you don't have any medical problems, you can infuse the stem cells and you're going to have lasting effects. As opposed to somebody who's 80 years old, who has diabetes, heart problems, kidney problems, liver problems, the stem cells have to work extra hard. So you have to have a higher dose of stem cells and more frequent treatment. So compared to a 30-year-old who has no medical problems, the stem cell treatment may be once every few years. But for a stem cell treatment in somebody who is 80 years old with multiple medical problems, you might have to do it every 3 months, every 6 months. Also, it depends on the disease state. For autoimmune conditions, actually you might have to do it every 2 weeks, followed by every month, followed by every 3 months. So it all depends on the host. So the host condition will determine the frequency of the treatment of the stem cells. Second, you must use the proper dosing of stem cells. If you have a very big person, a very big build, it makes no sense to use very little dose of stem cells because it's all going to be diluted out. So you need to use the proper dosing of the stem cells. And of course, the frequency depends on what the outcome is to be determined. So host, frequency, and dosing. These are the three most important variables. It's very important also we tell our clients that are undergoing stem cell therapy to prepare themselves for the stem cell treatment. For example, if you smoke, don't smoke for the next 2 weeks so that the smoke and the toxins are out of your body. And the stem cells, when we infuse it into you, are able to perform its job without having to clear the toxins. If you drink a lot, if you don't exercise, if you eat unhealthy, please change your habits so that when we do the stem cells, we're going to have a much better outcome. Now, I do have patients who will say, Doctor, what you request is impossible. I'm doing the stem cells to maintain my health while pursuing these lifestyle that I enjoy, like smoking, drinking. These are necessary for me to maintain in order for me to provide for myself and the family. And that's why I'm doing stem cells. And that's fine too, because the stem cells will repair your body and it will help reverse all the ravages that you're undergoing by smoking and drinking and having late nights. So we have to do the stem cells more frequently to maintain your health. So you can proceed to continue with your unhealthy lifestyle but still get the health benefits.
When you say your lifestyle is not so conducive for stem cell, how frequent do you think that would be?
For example, if you are 50 years old and you smoke 2 packs a day and you drink a bottle of whiskey every night, I think easily you might have to undergo stem cells every 3 to 6 months. And these stem cells we have to do every 3 to 6 months with what we call antioxidant therapy. The antioxidants are to remove all these toxins from your body so that the stem cells can implant and do a much better job. So I would recommend for those people who have such unhealthy lifestyle to first undergo this antioxidant treatment so that your body can receive the stem cell. And the antioxidant treatment, you might have to do it every month before the stem cell treatment and every month after the stem cell treatment. So results may vary based on your lifestyle and also the dosing, as well as the ability to follow the treatment program. For example, if you're prescribed antioxidant therapy every month for 6 months, but you only done every 2 months and you only done 2 treatments and you receive the stem cell treatment, you'll still get benefits, but you might not get as good as a benefit as if you comply with the whole entire treatment plan. So that's very important. That's why you need to sit down with your healthcare provider to have a treatment plan that you can adhere to.
You talked about the antioxidant treatments. What are these basically?
Antioxidant treatments are infused into your body because when you smoke or you drink, they produce these radicals. And these radicals or oxidants, they damage the DNA in your body. And that's what leads to apoptosis. That means your cell starts dying because they damage the cells. And damaged cells are programmed to die naturally because if the damaged cells don't die, then they create what we call cancer. So normal cells are programmed to die when they are damaged. So when you smoke or drink or you have unhealthy lifestyle, these oxidants go all over your body, damaging your DNA, and therefore it damages the cells. So what these antioxidants that are being infused into you, they reduce this oxidative damage so that your body can begin its repair. And when the body begins its repair, the stem cells go in, they secrete these cytokines that are further anti-inflammatory, and these stem cells also help the body's underlying stem cells to reproduce and generate repair. And then these stem cells that are being infused can change into tissues to help you to repair your body. So it's a combination treatment that gives you a much better outcome.
Thank you very much, Dr. Ken. Thank you for coming out today and talking about stem cells.
It's been a pleasure, and I hope to see you soon. And if you have any questions, please come and contact me, and I'll be happy to have a face-to-face consultation with whoever is interested in stem cell treatment.